Hello to everybody. I think you are tuned and we are starting. I apologize for the videos because they are high resolution, but at the end I will tell you what to do to see better. It's just in a channel of YouTube. So they are not going so fast, but I'm speaking slow and so we can synchronize it. Well, yes, I like to start always with this Benjamin Franklin sentence. Tell me and I forget. Teach me and I remember. Involve me and I learn. So what I want to do today is to involve you in the new technique of the AccuTite. So just a little introduction. These days we are facing problems among people around the world. Since the outbreak of a new coronavirus in Italy, the situation changed hourly and we have different scenarios in front of us. Our priorities are clear. We want to be safe, stay healthy, and make sure we come back stronger after this huge global emergency. I also want to do a special message for healthcare professionals, for all physicians, doctors that currently are serving on the front lines of this pandemic. Thank you for your dedication and sacrifice, which have already saved countless lives. We are confident that before too long, together we will overcome this situation stronger than ever. Okay, stay at home. And so now let's start. What about lower third? Lower third of face shows the aging scenes. As you can see, this on the left is Angela Merkel, and you can see the lower third is really aging scene. Brigitte Bardot still looking good, but you know, the lower third is not so nice. And Ursula Anderson, a nice famous actress. The lower thirds are really aged, but also the mid face show less volume than drooping skin. In 50s, empty faces. You can see on the left is very empty on the malar area, and everywhere we can feel it. So the mid face is good for feel. But even in 60s, the empty faces, and they have also sagging tissue, but really we put some volume and we add good results even without lifting these areas. So it's 70s, the empty faces are sagging tissues, are fold, drooping lids, and wrinkles, so starting to have many problems. The upper third show aging too. So we can see that the brows are going down, and so if you see the brow lift is a good result for a rejuvenation. Even rejuvenation effect is just when they are young. So the brows asymmetry or the height are extremely common down. So what we can do is to lift them. So the same problem is common throughout the world. Where I've been, and I think I can give you my experience through the world, is everywhere the same problem. But devices, but today we are speaking about devices, must help surgeons. Not replace the technique, only help. And this could be an help for us. But why we carry out a procedure with an energy device? Because it's the future. We need to be in the future, and we need new devices. So my key points of bipolar RF treatment, that's why we are speaking today, is long-lasting results. So I tell you that in 9 years, my follow-up is still good. I see after 4 or 5 years, again, the results are good, and so we can start to do another treatment. Low complication. Well, the numbers grow up, you know, the number of complication could go up, but I don't see too many complications in this. The procedures with no scar is really no invasive. It's a short procedure because we can do from 10 minutes with a brow lift to 40 minutes for a complete just all the face or neck and jawline. We can do before or after a lift, so this is not a great issue to do it, and it's repeatable. I repeat now, but I will tell you after that is not melting fat technology. It's not melting fat technique. This is just to make tighten. We can melt just a little percent, so 1%, 2% of a fat, but it's not a melting fat technique. Short downtime, yes, this is really important for the patients. We can speak to the patients that after a few days, 4 or 5 days, they can go out. And really important for the doctors, for the physician, is local anesthesia and the office procedure. So many doctors can do it in their office. What is available on energy-based device market? Well, a lot. So we have monopolar RF, microfocalized ultrasound, HIFU, fractional laser, helium plasma, IPL, LED, and more. What you can do in this market, very huge devices. So today we are speaking about one that is AccuTite. What is it? It's like FaceTite. It's smaller, but it has the same control. So it has internal cutoff from 60 to 70 degrees, external cutoff from 38 to 40. We can put what we need, what we want to do it, what the guidelines suggest for this treatment. Just a needle, 80G for the entry point. And as you can see on the right, is really small. It's like a cannula for filler. What are the indications? The indications are very thin skin when we don't have so much fat in some patients, or sometimes we can do it if there is a lot of fat, but sometimes we have our device with different probe. This is subdermal treatment. It's just a little superficial, more superficial than the FaceTite, and after I will show you. And we can treat all the face. This is the different about the FaceTite. So with this small cannula, we can go just in the brow, just below the frontalis muscles, below the orbicularis muscle, where we need less invasivity. A little, just to show you some comparison with the other technologies where the bipolar leads, because monopolar and fiber like laser, they need more time to heat all the tissue. You can see the same picture, but on the left we have bipolar. In 5 seconds we reach all the thermal containment in this area, but with a monopolar we need 23, so it's 4 times more. So the first thing is faster. Second is heating. The uniformity of RF is the distribution homogeneous. So you can see here that is a homogeneous heating all over the tissue. This is the body, and you can see just below what you can see. You can see that is only one red point, that this is the fiber is doing, and so we need to do just on the left all the tissue, but sometimes we don't have the homogeneity. So can you see now what I'm doing? This is a very old video. I have a fiber. This is 12 years old, maybe 15. I don't remember exactly. But I'm doing fiber in the fat. I am in the subcutaneous fat and maybe subdermally. But you can see only oil. I'm melting fat. This is melting fat because oil is growing in the table. And what you can see that I did here just a little hole. I go faster. Wait, okay. And look the hole where I did. So maybe here we can destroy the septa, and sometimes you don't have a great tightening. So you have, but not such a lot as you can have with a bipolar RF, because I have a thermal containment among the 2 electrodes. So that's what you are seeing. But now look at the below, and you can see I'm starting now with this one. Look at here, and you have a tightening effect. So now look, the pop-up effect. So I'm melting some fat, but more tightening. So I don't have any destruction of theta because I have a closed loop feedback temperature. So I stop at 70, and you know that at 70 we don't have any destruction because you will have from 80 to 90 degrees the destruction of theta and melting fat. So if I stop at 70, this is why. The reason is that it's not like a laser fiber, and we have a closer loop, bipolar, and we have more tightening. So another good thing is to show what my friends Piero and Chris were doing with Fermi and BodyTite. The imaging are showing you that on the right side, the BodyTite. On the body, you have all the tissue is heated, and we have all yellow. You know, the color of the infrared camera is coming more yellow, and so more heating on the skin. So you don't have this one in the monopolar. So now we have in the family different handpieces for different indication, from the big one to the small one. This is the small one we have, and this is the AccuTite that has a more superficial treatment. So we have up to 1 centimeter, so we can go near to the subdermal space. What we can do, we cannot do it with the BodyTite. This is bigger, and we can go deeper. So from the BodyTite deeper, and from the FaceTite, we are going to AccuTite. Morpheus 8 is just only for dermis and skin, but we will see in the next webinar. Now, first important things is an introduction. What is radio frequencies? I think you know, everybody know, but it's better to repeat that is an electromagnetic field that propagates through space, is applied to tissue at different rates based on tissue impedance, and delivers heat energy to tissue, no specifically. This is the subdermal effect of eatings. Okay, the breakfast is finished, so you can see now on the right, I can show you, this is a bacon. This is a fat coagulation. It's good, needs some eggs and good for breakfast, but now this is time for lunch, not for breakfast. So the coagulation of subdermal fat and the coagulation of fibrous theta network, this is what happened in our body, in the subcutaneous tissue and in the theta. The mechanism of bipolar is very easy to understand because it selectively hits deep dermis and fibrous theta network, because there is a cleavage of hydrogen bonds in collagen, and there is a denaturation. And this produces new collagen, angiogenesis, and elastin. So this is good for our tissue. Now let me show you RF, bulk heating, tightening. But look, if I can see fat melting now, sorry for, it's not fluid, but I tell you, it's fluid, and I can see a contraction with the FaceTite, with a small one handpieces with this fat. What I can show you is this contraction up to 40%. You can see here that there is on the left side of the patients, you can see a great contraction because this is the side that we have treated. So on the right is not yet treated, and you can see that is more volume. Only contraction, but this is enough. So what you can see is immediate contraction that we don't know exactly the percent, but sometimes it's going to 40%, maybe in 3 months, maybe in 6 months. But immediately, this is the result you can have. This is immediately post-op. You can see the neck, you can see has less volume and a great contraction of the tissue. And again, what I see in some websites, I see liquefied fatty deposit, liquefied fat cells, targeted fat destruction. Well, this is the only, maybe is right, fat destruction we have, but we don't want to destroy fat. We want only to have a contraction. This is a good nice microscope picture from Dr. Diane Duncan, that it shows that before, on the left, you can see the collagen matrix that binds adipocytes together. And with the agents, it erodes away, leaving subcutaneous without a structural framework. But you can see after a treatment, the new collagen matrix after a treatment of heating with RF surrounding adipocytes. So that's what we are doing, producing collagen in surrounding adipocytes. This is what happened. But the adipocytes stay and they melt just a little. Well, what we can do with the AccuTite. So the indication now are more than with face tite, because we can treat all full face. We can, as you can see, we can treat brow lift on the upper third, lower lids and malar bags and nasolabial fold in the mid face, and on the right you can see the jawline and the neck for the lower third. So all the face. When I show you the mid face, we can add also volume, and so we can do a full face treatment. Tightening is a great problem. Sorry for the mistake. Tightening treatment must be preceded by a complex algorithm assessment. So we need a pinch test for neck and for the jaw to evaluate the fat thickness. For the brow treatment must be preceded by a supraorbital laxity evaluation, so we can see if it's a good treatment for this one. For the lower lids, tightening needs low fat back, pinch test and distraction test negatives, and a moderate skin laxity. So the first case where I wrote, yes, this is a good for treatment. The second one where I say no is not good for treatment, but these patients had a previous as a blepharoplasty, complete upper and lower. For the nasolabial fold, we must evaluate the treatment just if there is fat and not drooping skin, because sometimes we have only skin that is sagging down. But now look at this video. Sorry always for the not smooth, but on this side, on the left side is treated, and on the right one is not treated, but you can see that the fat is still there and is here. Look, this area is still untreated. So we start for the neck and jawline. You know that the neck are aging, and they are changing the cervical angle with its inversion. So they change from V shape, look at the left side, and they are going down, and they are inverting the angle. So they are doing not a V shape, but a D shape. So we need to consider some key points to evaluate how to treat the neck. First, the depth of cervical angle. Second, the mandibular border definition, that we can do it with angle, with the device, with the AccuTite device. And mandibular angle definition of the border and the neck width. So there are some other labiomandibular for prominence, mental prominence, and platysmal band evidence that we can consider to treat, but this is the next point. So just a little few things to say you that we have an alternative correction about lower third and neck. So we can do many things like suturing digastric or defatting supraplatysmal fat, transecting platysmal border, correction of the border just with fillers or with fat, maybe liposuction or some thread lift. So this is your choice. The correction of the angle, we can do the loop suture elevation of SMAS. We have some kind of lift, fat grafting, fillers, and the correction of labial mandibular fold. You can do it with fat grafting or release with depressor labii muscles with Botox or thread lift or fillers, many other treatment. But what we can do now, we can do just with a very easy treatment with our AccuTite. You can see the first with red or purple color. You can see the dangerous area where it's better to avoid to treat, because there are some facial nerve, but we will see after in the anatomical space. In green, you can see the area, the treatment where we can do it, very easy and not so safe treatment, and it's not recommended, so you can do it. But the upper third and the mandibular border, I don't think they are a good idea. Just for experience, I can tell you, but you know, it's always your choice and you can do it. But just this is a recommendation. Few anatomical points. These are the safe compartments for lower third treatment in green. So this is another depth treating neck area. So this is a superficial safe area. This is pre-platysmal fat. We don't need to go below, because we find platysma that you can see here just on the right, below. Platysmal muscles is just below the pre-platysmal fat, and we need to stay on the fat. So fat compartment, cheek fat, submental fat, and nasolabial. Sorry, I go back. Okay. Cheek fat, submental fat, and nasolabial compartment. This is what we can do in the lower mid face, just to treat, and where we must be safe, even if we can avoid some dangerous point, like the facial artery. But we will see after in a video the facial pedicle, and so you can see that this is now very deep. So it's just going through the muscles, through the platysma, and is below the fat we are treating. Now look at, just with the courtesy of Incas Academy, what we can see here, the platysma muscles, and here, this is the facial artery. But in this place, just before the modiolus, you can see it's doing a big loop, just superficial. And so that's why we must pay attention in that area. And here, I'm showing you what happened just below the platysma muscle. You can see that there is masseter. This is the platysma, and this is the muscles. Sorry, maybe I'm not going at the same speed of a video. This is the nerve, the mandibular nerve, the branch that is coming from the masseter and is coming out and is coming more superficial. So that's why I'm telling you that here, this is the facial pedicle, the facial artery, and here there is the mandibular nerve. So this is the area where they are coming superficial. So we must be careful about this area. And the mental nerve is coming out here, just from this hole, and this is another area where we can stay. But I show you with the AccuTite in the cadaver. Hope to see you not very slow. You can see that I'm doing very low fat, and I'm passing with my cannula, and I'm hitting. If you hear the noise of the sound of the AccuTite, I'm treating, but you cannot see nothing on this fat. So I'm treating all among the two electrodes. So I'm more superficial. This is the first things that you must know. The assessment of the marking treatment area is just in a phase, just in this area where you can treat the lower lid, and this is the first superficial, superior limit is the orbital rim. So don't pass, if you want a good guideline, as a protocol, don't pass the orbital rim and stay below. When we are treating this one, we stay 1 centimeter lateral to the pupillar line. And so we have just 1 centimeter, not more, to treat it. But we will see after better. And so this is for the jawline. We treat, and we draw the mandibular edge. So we don't treat on this line, but we will treat below and above this jawline. The nasolabial fold we see that I'm treating the fat just above the ligament. So this is my marking. This is the line where I don't want to treat. This is in green what I'm doing. So I'm treating above and below the jawline where the fat is drooping down. In the red, you see the dangerous area where the mandibular nerve is coming up and even the mental nerve. And this is one point that you can use to enter and to treat all the neck. And this is another point that is my point, but I'm preferring this point because I'm doing a crisscross technique. So I'm treating all the neck and I'm treating also the above the jawline. And from this side, I'm sure that I cannot hit where is the superficial nerve. Device. This is the display. It's very easy. I don't know how many of you know it, but you know this is external temperature that I can put from 38 to 41. This is my cutoff, and you can modify your factors. Depends from the quality of the skin. You can see. Just depends on you. So the internal temperatures must go from 65 to 70. 70 is the limit. You cannot go through the 70. You cannot push up because 70 is tightening limit. You can modify this factor just the thickness of a subcutaneous fat because more thickness you have and more temperatures you need to reach because you have more space to reach the surface. So that depends on you. We start with treating. Yes, we can do local infiltration with cannula. After I will show you what you must do and how much is the anesthesia that I'm using. Local anesthesia is just a client modified, so it's much more concentrated. And usually I don't need more than 60, 80 milliliters for all the face and neck, for neck and jawline. And usually I distribute with a cannula. It's usually at 21G, and I'm distribute everywhere just on the. This is the treat, how I will treat. Usually we divide in quadrants in the wedge area because the correct treatment means that you must do all the heating just homogeneous in the first, in the second, in the third, in the fourth quadrant. If you are going backward, you have an undertreated zone, like number 1 on the left side, on the right side, sorry. And you have an overtreated zone that is near the entry point. So this suggestion is to treat this one. It's really, really easy surgery table. As you can see here, I have a face tile, but I can have an AccuTite. So I need only anesthesia, some drapes, sterile drapes, and to disinfect, and gloves, nothing else. For the local anesthesia, usually I told you this is my dilution is to 40 to 60 milliliter of saline solution. I use 20 milliliters of lidocaine, 2%, and 1 milligram of epinephrine. Many people say, many doctors say, oh, it's not enough because I want to be safer. But to be safe is enough because you don't protect anymore of your. The really important maneuver is to do it superficial with my AccuTite, not to do more infiltration. More infiltration means don't see what I'm doing, and this is a stupid way to use it. I want to see what I'm doing, not just heating and nothing else. Now, this is what I do usually. Well, this is the pinch test. I think it's better to do it before starting, but this is just for you to show it. And I'm doing a pinch test, and when you see that it's not so much fat, this woman, and I'm treating now this area, the neck, and you can see that I'm in the office, not in the hospital, in the clinic. And look, this is really superficial treatment. I inserted my probe in the subdermal or superficial subcutaneous layer. And now I'm starting. I'm treating and I'm going backward. And now I'm not doing the stopping technique. After I will do it, I will show you. But stopping technique is just sometimes where you need to fix and to create just a contraction in some points, in some gravity points. But now in the neck, it's really very, very thin skin and not so much thickness. So what I'm doing is to going backward very slow and to treat. Don't go too much fast. I see many times many doctors are doing fast. This is not a liposuction. I need to have time to release heat on this setup. This is what I'm doing now in this area, but it's submental, it's just below the chin, but you can do it just everywhere with a crisscross technique, as I told you, just with some different points. The points are just submental, you can see below the chin, this point in the middle, and you have two lateral points just in the line of the commissure on the corner of the mouth, and the other points are just sublobular. But I tell you that you need few points with the AccuTite because it's shorter, and sometimes you don't reach all the jawline. Now I'm doing the jawline, and this is the Rovatti. I call many people, many doctors say this is the Rovatti rotation of the probe. So I'm putting the probes just towards to the bones. And look, my cannula is superficial, and I'm treating this area. In this point where there is a lot of fibrous subcutaneous tissue, you can stop because this is more safe. And you can stop, you have a stop technique in some places where you want to fix. But I will show you after because there is a different subcutaneous. And this is just above the jaw. Just a little treating area where I want to reduce the fat, and I use the stopping technique or moving backward. Never doesn't matter if you're going from this side or from the other side. This is your choice, and it's not important if you go backward from lateral to medial or the opposite from medial to lateral, because you are doing a fibrosis, a tightening line. It doesn't matter if you do from, yes, look, or from the other side. This is from mandibular angle entry point, and I'm doing just respecting the dangerous area, and I'm treating from the other side. So it doesn't matter. But what you need is to treat this area. And this is stop hitting at the fascial pedicle level. Remember the anatomy. This is really important. So we have our guidelines are to show you that maybe in some kind of patients we have 1, 2, 3 kilojoules and not more for the jawline, and 4, 6 kilojoules for the neck. But it depends from the thickness, from the kind of skin, and many factors. But you will learn. And so what you need usually is a training. Sometimes it's better don't start alone in this technique, because heating sometimes is really is doing good results, but sometimes, look, now I'm treating and I want to show you that it's not a fake, and this is 40, 70 degrees, and now I'm treating 2 kilojoules and I have a temperature. This is the treating we do just in the neck, but I think we can go to the hand, because now you have seen what you have. Now, it's your choice. Well, I want to show you that I've seen just on some YouTube, some doctors like this one is doing with another device really, really invasive. Well, maybe he can do it, great results, many beautiful results, but just I tell you, I prefer a soft treatment. I can imagine that my small cannula is less invasive, maybe less downtime, less recovery time about this treatment that is really a big device. So that's my suggestion, but it's your choice. I prefer to do less invasive. And what about mid-face treatment? So this is the first of a mid-face, very easy treatment. So if we have the middle fat compartment, this is the fat just above the commissure, about the nasolabial. So I'm treating the superficial fat. Look, I'm putting the gel and I'm treating. This treatment needs 5 minutes. So I don't think you can go with the previous device that you have seen treated. This is really a very superficial fat, so we are treating with this device. What you can see now is that I'm treating only fat. In this area, we can show just after on the cadaver, but you will see that there are no very important. The facial artery is more medial and more deep, and here we have only fat and no nerve connection. So we have any nerve, so we can treat in really safe way. Sometimes some nasolabial fold must be treated in this way before to fill sometimes, because this is, I think, is the best way to reduce the fat that is sagging down and is stopping just where the ligament starts. And sometimes if you start to feel, maybe sometimes you can have a worse results. So that is good treatment above the line that I've seen, and I'm treating, look, stopping and stopping. So maybe now you see stopping because it's not fluid, but you can see that now is stopping technique because I'm reducing the fat. You must know that if I'm stopping, I'm hitting more the vertical septa. So I'm reducing the depth of my tissue. If I'm moving backward, the hitting is going preferentially to the horizontal septa. So we have a contraction, a tightening of the width of the tissue. So we can have a 3D contraction, depth and width of the tissue, and the left sometimes. So look, this is stopping. My friend from USA, stamping, but sometimes people understand stamping like press the device. No, it's only stopping and wait that the device automatically stop, because we have a feedback, we have a cutoff. Just when you reach the temperature, the vertical septa, it stops. I make you see this noise. This sound is just when you reach and it stops. This is safe. This is safe because I cannot do just for minutes, 2 minutes, 30 seconds. No, it stops automatically. And this is a safe feedback cutoff. Okay, now let's go. And maybe you have seen a lot of this one. Okay, this is what I've treated. Just on the left side is smooth and is better. And here you have more fat on this line. Just some cases, just to show you, this is a great nasolabial bulging, you can see, and this is really difficult to fill. I don't know if you can fill, if you fill here with a filler or with fat, maybe it's not good because you have more bulging of a tissue. But when you treat and when you reduce a little amount of fat, you maybe in this woman have a good results, because in the mid phase, this is a great effort. So the nasolabial fold is one of the most requested treatment of a face. And this is another one. But you can do it in the same time that you do a filler, 5 minutes and you treat. You see that here I have always just in the jawline and in the neck I have it treated. So you can see the nasolabial fold, the jawline and the neck are 3 issues that we have fixed. So this is immediately after. This is a patient from Philippines we have treated. So this is immediately after. And this is after a few months. You can see that this fat is reduced. And so we have a good result. What about safety? I told you that we have a control of the temperature, so we have an epidermal and internal feedback cutoff. So when we decide to stop at 40 out and 70 in, the device stops automatically. So we don't need to go to see the display and every time. We have only the sound to hear. We have also a rate of rise of temperature. If it's going too high, too fast, they stop. Temperature surge protection, and naturally, obviously, we have a FDA approval. So this is our flag of safety. Less downtime. This is 1 week after. You can see the red on the neck, the red pins, just about Morpheus, about fractional. So they usually stay a week, 10 days. So after a week, the patients can go out. Or we have more tone. This man, we have more tone and firmness of the tissue that I want to show you just bending the neck. So we don't have all the amount of skin because we reduced the length of a tissue, and we have a contraction of a tissue, and we have production of collagen, so that the tissue are more toned. Now let's go to the upper face, and I'm really happy to do it because brow was one of my first treatment that I did with this device just a few years ago. And we must speak about, just with a little introduction, about eye rejuvenation. You know that is one of the most popular aesthetic procedure, blepharoplasty. But now, and ASAP's report is the 4th of the most frequently procedure. So this is really important for a youthful appearance to have a periorbital rejuvenation. And you can see this one is much better when you have no lower lid bags and no lower lid laxity of the skin. So the patient selection is really important. I showed you before, you must do it only when you have no indication for fat pad manipulation, when you don't have so great fat bag in the lower lid. We are speaking always about lower lid. And if we have moderate lower lid elastosis and rigidity, so if we have too much laxity, excessive lid laxity, this is a contraindication. Don't do it. It's better to do a blepharoplasty. And please check with a snapback test and distraction test. If it's negative, it's okay, you can do it, because if not, you can show you after some my mistakes about some treatment that were maybe they were too much, they were positive. So there are many plastic surgeons, oculoplastic surgeons that are speaking about the management of lower lids, but now we must speak about also this treatment that is treating all the lower lid bulging, and please respect the orbital malar ligament. So please don't go above the orbital rim, and so you are safe and you have not the problem that you can have is a sclera show or ectropion sometimes. And so you can stay just above the zygomatic ligament and below the orbitomalar ligament. So in this area. This is an animation, but I want to show you better just the anatomy. So we have lifted the orbicularis oculi muscles, and this is the layer 1. And so we are going deep in the SUF, and this is the SUF where we need to treat. This is the area where you can have a contraction, a tightening of the fat tissue, and consequently, you have obviously even the skin tightened. So now I want to show you what is the level of where we are doing. I hope you will see not so, well, very fluid, not so much, but you know, here I'm treating, and I'm below the orbicularis muscles. I am in the suborbicularis layer, and I'm doing dual plane. So first, a contraction of the muscles, and the second plane is much more deeper, and I'm going just on the SUF. So this is a dual plane technique. I use a 18G hole just with a needle, and I'm treating the SUF. And so when you see, you cannot see now that I'm doing stopping and moving, because stopping is just deeper, just in the depth of my, sorry, because the volume of this is very high. Okay, I'm treating the depth, the SUF, and this is now a superficial and subarbiculary. When I'm doing submuscular, subarbiculary layer, I'm going backward slowly, but I'm going backward. I don't stop. Look, this is going backward. I hope you don't see stopping, but you see slowing, because just if this is internet connection, I don't know. And these are very high resolution, but I prefer you see. And I tell you that after you can see on the channel of YouTube is just, you can see this video and you can see better. And I will give you just the link, and we can see also in the surprise I will give you. Okay, this is moving and stamping technique, dual plane, and this is good. Remember, don't go above the orbital rim, and this is what you can have in this kind of treatment. Now, let's go ahead. Now I want to show you, just during a lower breath, what is happening on the muscles when I'm treating. So that's what you can see. Sorry for the lights, it's not so beautiful, but you can see that now I'm treating, and you see just a little contraction of the muscles, just as when you do just with the electric coagulator. Some of the same things. You don't damage the muscle, you don't have a big contraction. So starting from the mistakes, these are one of my first cases a few years ago, 2 years ago. So after Morpheus treatment and AccuTite, obviously, after 2 months, what I can see, a good result for the patients, not so good for me. You can see that on the lateral canthus, you have a little scleral show, but no problem, no issue. The patient is not complaining about this problem. No hyperlacrimation, nothing else, but just only I suggest to her, what do you like? You like this treatment? Yes, I like very much, and that's enough, even just for this, because I was maybe too much high. And I show you the same issue was to treat the higher, more than maybe orbital rim. I've treated, and look, just on the right eyes, you can see a little scleral show. That's not a good, just aesthetic effect, but the patients are happy. Next time, when you want to treat just above the orbital rim, treat with Morpheus, and so you will have a good result about skin, and you cannot treat the bulging fat that is in this area. So treat only below. This is photos after 2 years. This is just when I understood that don't go too much higher near the eyelash. And now we have a good result with Morpheus and AccuTite. Usually I treat with 2 devices, 2 probes, and so I'm combining the technique. This is really good even for fractional, because I'm treating only the skin with 1 or 2 layers. This is, well, I like this one because this was really, well, not for, she didn't want to do blepharoplasty, but I proposed her, but I was not so convinced about the results. But anyway, we have a good results, no scar, and good results even without blepharoplasty. So that's not an indication for you, but sometimes you can do it, and you can have, if they don't want scar, they don't want a more invasive treatment, you can do it. And so don't promise too much results. So this is my consideration after a few years, 46 patients treated, the 80%, 87% has acceptable results. And I have only 3 patients with scleral show, is 2.5%. So insufficient results, 6 patients, but if it's insufficient, you can treat again after a few months. After 6 months, you can treat it again. Well, now we are going to the malar pads and festoons. This is a combining treatment with fractional, and this is a really, really great news. There are a great current management of malar bags, so many people everywhere in the world are treating everything. They're doing mid-facelift and vertical subperiosteal for malar festoons. They are doing many surgical things, or sometimes non-surgical treatment like hyaluronic. But I don't think it's a good idea because it's just only a camouflage, and sometimes because we don't know exactly what is malar bag, but maybe some local edema, maybe you can add the malar edema because you can with a hygroscopic treatment like filler, like hyaluronic, maybe you can cold some water again. So this is not good. But sometimes you can do a fat grafting, but this is only a camouflage. If we want to reduce these wrinkles, these bands, this bag that we have, the Japanese philosophy say that is a way of life we can appreciate simplicity. And Ezra Pound said, all great changes are simple. So sometimes simple and simplicity could be the best results. So this is really easy. Look, always my 18G needle, I go deep in the tooth, really deep, and after I will show you, this is the zygomatic entry point, this is a safe point, and I'm going very deep, and I'm treating the line that I've marked before, previous marking that we must do. Just remember when they stay up, not lay down in orthostatism. And I'm treating. It's the same treatment that we are doing in every file. But usually I use dual plane even here because I'm doing stamping or stopping, call it as you want, going deep, and I'm treating the fat. And after I'm doing superficial moving backward technique. So usually we don't need so much eating. So usually 0.2, 0.3, 0.4 of kilojoule is really 5 minutes of treatment, and that's enough. That's enough to have a contraction of this tissue and sometimes to reduce the malar fat bag, but usually are really a great problem. So I show you this case. Interesting, because I removed the skin. I just removed the skin. I didn't manage the fat pad because she didn't have fat pad. And what I had just on the, you can see on the right, there was a malar edema. This is a photo after a few months, still yet there. She was not going. And the patient was complaining me, now is worse than before. What I can do it, I did AccuTite, and so I reduced this edema, this contraction. Well, AccuTite is not reducing the swelling, but maybe is tightening the tissue. But this was, for me, is a great save for me and for the patients. This is another patient. You can see on the left, there is a big malar edema, a big malar bag, and even from this man, you can see there is coming something like festoons, and this is a great result. Look at this one, is great, absolutely great, even this patient. So I think after sometimes I treated with high focalized ultrasound, that I have some results, but the idea was, well, start with some more heating, more heat, and so we have this result. So this is good. What about upper third? You know that the aging pulled down the upper eyelid, and so the brow achieves more ptotic position. But even when we do a blepharoplasty, if we do a skin resection during epilepsy, if we doesn't pull eyelid tissue down, but if the skin management is gentle and not so excessive, so if we reduce a little, we can have this area, this very full area, and it's good effect. But if we do just an upper blepharoplasty without the brow management, that we can do in many other things. So I'm suggesting this with AccuTite, but you can do it just a direct brow lift, you can do it thread lift, you can do everything. But I'm telling you about the brow management could masculinize the female patients, lowering ESF and elongating SFA. What is ESF? Is the distance from eyebrow to supratarsal fold that you can see in the left side just with the arrows. And this is SFE, the distance from supratarsal fold to eyelid rim. And if we reduce the ESF and we have more SFE, we don't have a good results because we have elongated SFE, but we reduce the ESF. So this is a masculinization effort, and this is not good. So first we must do it, the brow management of it. And so this is what I show you. This is a patient that I had a few years ago, and I told her that it's not only a blepharoplasty treatment, but we need to elevate. And I treated a few years ago with Ulfera, with the ultrasound treatment. I have a good results, but not enough for her and not enough for me, maybe. This is after 3 months with a Ultera treatment. So less weight on this eyelid, but not so much. So what I do after, I say, okay, we're doing upper bleph, and this is what. But this is 2 months after, but you can see that ESF is not very high, it's short. So what I did after, we did AccuTite on the brow, and we did after 3 months an elevation of the brow lift of the arch. So I think it's not perfect, but if you can see on the left side, you can see that the results now is better. So we lose one year, but we understand exactly what is the management of the brow. This patient is just to show you that sometimes the ptosis of the eyebrow happens in patients that they have no active frontalis muscles. These patients had a long story of frontalis muscles treatment with botulinum toxin. And so every time toxin, all the time the frontalis muscle is no active. So she needs to keep her eyes wide open. She has no hyperthyroidism, no. It's only because she is the frontalis muscles and is doing a face like, something, a surprise face. After the treatment, we manage the brow lift, we did the brow, and so we did also a good results about the face and not the surprise face. But there are many treatments to manipulate eyebrow height. So we have a brow lift, direct and transblepharoplastic approach. We have an endoscopic brow lift with internal fixation, or manipulation of periorbital muscles, or many things. A coronal brow lift, wow. So invasive, many other things that I don't show you, but what we need to know. We need to know the anatomy, because here we have a supraorbital nerve and supraorbital vessels. This is a courtesy of my Incas Academy. You can show this, my friend Cotofana is doing a good dissection. And so they are showing this kind of fat where we have to treat, because this is the supraperiosteal deep fat. And this is where we need to put the device to have a great tightening effect of the muscles. But this is the safe treatment area. This is the only safe treatment area, because after many other labs I did, I saw that the supratrochlear nerve, the supraorbital nerve, and zygomatic temporal nerve are going superficial. And so in this, only in this little space that is 1.5 centimeters, not more, and not more than 1 centimeter deep, where the supraorbital I showed you before is coming out from the bone. Don't treat in this place. And this, if you treat just a little, 0.5, 0.4 of kilojoules, it's enough to have a contraction of this fat without damaging and without having no neuropraxia in this area. Just to show you something, this is the local anesthesia, always with a cannula, and I use usually 4 or 5 milliliters of the mixing solution, about saline solution and lidocaine. You can see that I have an undermining of my tissue, of my muscles, and after the anesthesia, I can treat. Look, the patient is not sedated, is not nothing I gave her, it's just a little, very slow infiltration. You don't have any pain, it's not painful treatment. And after this treatment, you can start to treat. And now you will see. Remember, all these videos you will see on the YouTube channel after, if you want, just to have. And I wrote some things that you must go in from the airline. Stop there. Don't go to the eyebrow, but stop before, because we have 1 centimeter dangerous area. Stop here. Look, and I'm treating this area. This is the only area where I go. No 2 planes, only 1 plane, only below the muscles on the supraperiosteal. I have above the periosteal space. This is where I'm treating. Look, I am backwards, usually 1 or 2 lines in the same area. Don't move among these, stay among these 2 lines that are 1 centimeter. Remember, the more medial line is 1 centimeter lateral to the pupillar line. And after you have 1 centimeter, this is a good safe. You know, 0.2, 0.5 kilojoule maximum for side, and usually I put 39 external and 65 internal. But usually when I'm doing and I'm treating, so you need few minutes to treat, I be careful to go and to overheat this area, just a little, maybe less time, but the result is during, but not problem, and any issue, any complaining of the patients. This is the area where we are treating above, and this is the depth, the thickness that you can see. You can see the muscles and the fat. I think you know that there is a fat, a little layer of fat below, and this is our safe place where to put our device, our camera. Look what's happened if you don't treat the fat, but I'm treating the muscles. This is the frontalis muscle. You can see I'm treating, you have a little contraction. Okay, this is the cadaver, but you can see that is not a great contraction, so you don't have a paradoxal effect. But sometimes you can have this effect immediately after the treatment. Don't be afraid, it goes. Okay, this is the infrared camera. You can see that above our eye, you have a line of treatment, of heating, is white. And this is what happens, some paradoxical effect immediately post-op you can have, but usually it's the muscle, is a contraction of the muscles, but it can stop after, you can look here, but it usually fade away after 24 hours and not more than 2 days. This is a symmetry. This you can see the right brow is down, is much more down, and now is higher after 2 months. We have treated only right brow. And this is before 1 month and 2 months. The result now is 1 year and few months, I don't know, 1 year and 6 months maybe, and it's stable, it's still stable. And I don't have any more feedback because, you know, it's not more than 2 years that I'm treating. This is a brow lift. You can see that there is less skin on the upper lid, on the right upper lid. And you can see even the asymmetry is after the treatment, but you know, the height and shape of the brows usually is common, and the patients are not complaining about this one. But here, I don't know exactly what happened, but usually on the brow, on the right brow, usually I'm higher, even if I treat of the same kilojoules, because usually I do the same from one side to the other one. But look, on the right eye, on the upper lid, less skin on the eyelid. This is good. Even this one has a treated just below the neck and the jawline, and even the brow lift. Even this one, look at the right brow, always higher. I don't know, someone can tell me why. And this one, just before an upper breath, I manage the upper breath, and so they are flat brows, and I try to give an arch just to the lateral of the brows. And so after a blepharoplasty, an upper blepharoplasty, and a brow lift with an AccuTite 0.2, the results I think is good. And this again. And always the right is more high. Tell me why. Side effects. Now, after 1 year, these are only consideration after 1 year, but 32 patients now. I'm 2 years treating. I'm not updating this one, but usually 80% of most of patients have numbness and tingling in the head. So this is normal. You tell them before, but it's normal. It's going. Even if you use ultrasound and use Ulfera, maybe you have the same problem. But you know, this is normal. It's not dysesthesia. It's not neuropraxia. It's not a damage. And I had some not good results, insufficient results, 2 patients in this 32 that is growing. But anyway, it's not a problem. You can treat again if it's not enough. Well, consideration, final consideration about this treatment: easy to plan, simple to carry out, relatively safe, is not downtime. Absolutely, you can go out the day after. No scar, and well, it's still stable after 1 year, waiting how many years it's going to do. Very low complication, and this is a satisfactory result. But we are near to finish. Now we must speak about contraindication. If you have too much laxity on the skin, if you have in some places where you are heating free silicone implants or some metal implants, pay attention, you are heating, so we are damaging. So ask and do a good anamnesis to the patients. If they have a pacemaker or electric defibrillator, you can have an interference because this is an electric device. Pay attention, ask to everybody. If they have a recent massive weight loss, maybe the septal structure are not so good, and so you cannot have a good result. So wait, the patient is stable with the food, with alimentation, with protein, and with everything. Or you can give it to him, give protein, give a good integration. So send him to doctors specializing in it. And if you don't have fat, if you have only skin, don't treat it. You don't have your target, you cannot have a result. What about minor complications? Well, minor complications are, you can manage it. Them like irregularities, maybe you don't keep flat during backward heating. Use the Harvard hand. Long-lasting edema and induration reduce the total energy. Maybe it's too much, but you know, it's going. Asymmetry, maybe you didn't do the same amount of energy from one side to the other side. Please remember, look, you have a counter. You check the side from left and right, you must be the same if it's not asymmetrical. The hardness of tissue, they ask you, tell before, because it's normal. Up to 3 months, please tell that they will have hardness tissue. But this is our check of our treatment. This is good. If you don't have a good results, repeat the procedures, but not before 6 months. Wait. Sometimes if you do before, maybe you can make an interaction. So please wait. And I know it's not good for the patients, but it's better to wait. Sometimes they have hypersensitivity in the area we have treated, so masses can be useful, but usually it's fade away. If you have thermal nodules you can message, you can do intralesion steroids. They cannot go away. Sometimes they can go away if they are very superficial. But you remember, if you did, maybe you was to be too much superficial first, and sometimes they happen in the entry point, so the nearest where you have an overheating, and sometimes at the end when you start, because sometimes you are too superficial. But I will show you after. These are major complications of the energy device. This is an over retraction because this was too much superficial treatment, and this was a thermal injury because it was overheating, because this was too much fractional treatment, and too much superficial in the entry point. And that's fade away, that's good. Healing was good, but pay attention, because this is not good for the patient that is calling you every day or every week. So this is the most important, and this is not so common, but you know, if it happens, don't be afraid. This is a fascial nerve injury. This is a neuropraxia, but it's only a praxia, it's not a damage. It's not a permanent damage of a fascial nerve. This is a temporary side effect, but we need a prophylactic therapy after the treatment. You can see these patients up on the left. This has a little damage on the nerve, on the mental nerve, on the mandibular branch of the fascia. And sometimes the patients, they call you and say, "Doctor, what is happening?" Tell them before. And usually I do nervonic acid, B-complex, and oral steroids just to prevention. What about antibiotics? Well, whereas many people I saw everywhere in the world, many people don't do it. Okay, you cannot do it. But sometimes this is a phase diet treatment. The doctor sent me this patient, said, what happened? Sorry. What happened in these patients? Maybe too much hard, too much heating. No, I think it's very soft, it's smooth. Well, you can press and you can find something. It's edema, but maybe infection. Did you give her antibiotics? No, obviously, I don't give for this one. Okay, but I opened it and she was full of infections. So we drain it, but you know, sometimes this is just to advise you and to tell you, sometimes antibiotics could be good. These are our thermal devices. So this is the meaning of this slide is Fermi, Smart Lipo, everything laser, everything is heating and everything is good damages. And sometimes you can have a necrosis like a laser lipo on the below slide you see on the right. This is a necrosis, and sometimes this happen, but they have good healing, but it's not good for the patients. So pay attention with radio frequencies and with all heating devices. Learning curve, this is the first critical key points. Well, the learning curve needs a training. And so that's why we created a practical and theoretical training center. This is mine, and this is what I'm doing with doctors. You can see on the right, they are coming in our clinic. And you can see here, there are a lot, but usually we do not a face-to-face, but very low people. But everybody, they are trying. You see that they are looking, they are filming, they have a monitoring on the video, and sometimes they can try on the patients, they can try with their hands. And so that's good, because sometimes it's so different to see a video and to see something. And after we have a theoretical, very practical session, so we are speaking and we are asking, so question time is really important for us to do it. The second point is the critical area for heating, but here there is no doubt. What you must do it is follow protocol treatment and remember anatomical key points. That's really important. So some people say, oh, if you don't have this one, the device cost. Oh, everything is costing. But depends. What is your meaning? What you are updated surgeon, you want to do something more versus traditional surgeons? Or how many surgical procedures I do on the face? I still do facelift to everybody, or less time surgery. I want to do more patients and I want to have less risk. That's my goal. Or what's my approach to arms? What's my approach to inner thighs? What's my approach to upper abdomen? So to this area where I cannot do many other things? Well, this is my question to you, and this is the reason to pull the trigger. Now, this is the site, the link where you can see on my channel. Look at here, there are all the brow lift, the lower lids, the Mallerbag nude, the AccuTite nasolabial fold, and the jawline, so you can see, and so you can see at the right speed. Take it, you have the time to take it. And now, until I'm preparing this, I want to show you the surprise that you are waiting. So now let's go to this wonderful thing. Now, the last but not least, you can see, sorry, now I must prepare it. Sorry if it's not, okay, go to the screen. Okay, that's perfect. Now, this is the website that InMode had prepared for you. It's just for all AccuTite faces, but this is interactive. So now, let's start, and you can see what we are preparing. If you were at IMCAS, we presented just the trial, the starting point, but now it's finished. And the interactive experience could be better, because now you can see everything about AccuTite.
Will introduce you to the world of RF InMode. You will appreciate the easy way to use it and the effectiveness of this device, obtaining results never achieved before. I will take you discovering the secret of AccuTite, revealing tricks and tips of this new no-invasive surgery.
Okay, let's starting.
Welcome to the AccuTite interactive experience. During the video, you can choose what to watch and
you have a few points where you can go. Where do you prefer?
To make your choice. I hope you enjoy this interactive video.
We start. Look at my hands. I go to brow lift, and you can see the points that I told you, the area and everything. So you can go to the treatment, to the anesthesia, and you can see. And so this is interactive, and so you can do treatment of the eyebrow arch, and you can see the treatment of this one.
Through an opening.
If I'm tired, I go to the main menu, just on the on the back here, and I go to the main menu. I press.
To make your choice.
Sorry.
I hope you enjoy this interactive video.
I go to the main menu. Now I want to show you the treatment of a nasolabial fold. I go and I see the marking, and I decide what you go, anesthesia or the treatment. If I go to main menu, I press, sorry, I'm pressing, go to main menu. And I want to show you, this is a good
I hope you enjoy this interactive video.
I go to the treatment of jawline, for example, I press, and I can have a choice. What I can do, anesthesia, treatment, or the anatomy. If I go on the anatomy, you can see the anatomy where you are treating.
The superficial fat is just fibrous, much more fibrous along the line of the mandibular edge.
And you can see in a perfect definition what fat are treating with AccuTite, and so this section of fat, and so everything you need to see what are you treating, where are you doing. Now you can see the platysmal muscles, and you can see all the points, what's happening, and all what you need. But going back, you can also go
to make your choice.
To make menu and
I
the
hope you enjoy this.
So maybe I want to show you,
in the lower third of the face,
maybe I want to see the anatomy, no, the dangerous point. I want to see the dangerous point. Go to dangerous point, and you can see what I showed you before, the line where the muscles finish.
Under the anterior edge muscle.
I think the words are more better. This is speaking about the fascial arteries closing a loop. I showed you before. So that was my surprise for everybody, for you, and so that is finished.
I hope you enjoy this interactive
I think
video.
we can finish.
Good morning, everyone.
Thank you, Dr. Rovatti, for your amazing job always.
Finish just with this one. We would like to thank you for your trust in these challenging times, and the health and safety of you and your loved ones always remain our highest priority. Thank you to InMode company to continue and to support our job. Thank you for your attention, and a great hug to everybody from Italy. We will be back after COVID. Ciao.
Ciao, Dr. Rovatti. Thank you again for your amazing job. It was a pleasure. Thank you, all of you, for joining us again. And we will send you all the links and what Rovatti showed you, also the recording of this webinar. Thank you. Take care, stay home, and we will see you again soon. Bye-bye.
Ciao to everybody.
Ciao.